So the foster care system is very difficult. It's very complex, and there is a lot of human error in it. It started within racist roots too. A lot of the parents don't want to abuse their kids. The problem is that a lot of those parents were mistreated themselves. The 0 to 2, it is the highest number of children who enter foster care in the US. We need to figure out what we are. Life is intrinsically meaningless, and we give meaning to life.
Welcome back to another episode of the Last Zebra podcast. I'm your host, Ugo Ezema. As always, please don't forget to like, share, subscribe, and comment, and engage in the comment section. I have a special honor, a good friend of mine, although we don't hang out often because we play soccer together, Dr. Sebastian Del-Corral. Welcome to the show.
Thank you so much. Thank you so much for having me. Yeah, I wish we play more soccer and hang out afterwards.
I agree. We'll start setting up some non-soccer hangouts for sure.
Yeah.
You're a clinical psychologist.
That's correct. Yes.
For anyone that doesn't know, what is that? What is that?
So I work with, so I got my doctorate in clinical psychology. It was similar to a PhD, but it was more emphasis on the clinical part instead of research. And I work with patients and families working with their mental health problems and assessing their needs, mental health needs and personal needs and areas of growth.
How long have you been doing that?
As a clinical psychologist, it has been 4 years. I graduated 2021.
Where did you go to? Where did you get your doctorate from?
I went to a grad school in Indianapolis.
Oh, wow. I didn't know that.
Yeah. It was. I was in Texas for my undergrad in North Texas. And then I went to Indianapolis, to the University of Indianapolis for the graduate students.
I did not know that. Where's home for you?
It varies, but I grew up in Chile, 21 years raised and born in Chile. And my parents are from Peru.
Oh.
So my whole family immigrated from Peru to Chile. And I was born and raised in Chile. And then I moved to the US when I was 21.
Are there a lot of cultural differences between Chile and Peru?
A few. Yeah, the way of talking, it is kind of similar to what we would say Canada and the US.
Okay. So like there's certain, the way you inflect on certain things.
Right.
Who do you associate yourself with? Which one are you more, because it's Peruvian, right? Or
Yes.
Chilean. Which one are you more?
It depends on who's winning on the football pitch. And none of
So
them.
it's always Chile then? Because I know Peru, when's the last time Peru beat Chile? It's probably been a very long time.
But Peru went to the World Cup in Russia and Chile didn't.
That's true.
And this time, none of them qualified. They were last and before last.
I know, obviously, as growing up in the Caribbean, and I'm from Nigeria, and being a fan of football, that's one thing I love about football, world soccer, is you get exposed more than almost any other sport. You get exposed to different countries at a very, very early age, because like the World Cup comes around every 4 years. You know, you're getting exposed to the names of countries, and also in a smaller way because you're watching the games, and they talk about the profile of the countries. You get to learn a little bit more of them. Chile, I know because of Alexis Sanchez, who is probably your greatest ever player, probably, maybe.
Yeah, he and Salas or Zamorano back in the 90s, late 90s.
Wow.
Yeah.
So growing up in Chile, how did you decide that you wanted to be a psychologist?
So I didn't know yet when I was in Chile. After graduating high school, I went to law school for 2 years. And I was not dedicated to the academics, if we are very polite. And I was I was playing basketball, so I got a scholarship to play and study law school. And as I was studying, going to classes mostly, I started realizing that I really like the family aspect of the law, like family law or how the law impacts the family functioning. And then after they asked me to leave the university because of my grades, I took a gap year, and then I figured out that I really like the mind and how people think about things and how the society helps people or is detrimental to people in many ways. So I started thinking about psychology in a different way. And I started undergrad in Chile, and then I moved to the US when I finished my undergrad here.
So what was your original undergrad in? Because you went straight from high school to law, because that's how we do professional school. After that, you started undergrad. Once you got out of law, you started undergrad there. Did you start undergrad in psychology?
Yes, in Chile. I did 1 year and I loved it. And at that time, I didn't know what I wanted to focus because psychology is so broad. But I knew that I wanted to work with people. And as soon as I came to the US, I was 22, and my aunt was married to a psychiatrist, and he worked with children in foster care. And he had this practice where he would provide medication for the children, and I would be his assistant a few days per week, where I started seeing all the need for the mental health for these kids. And I worked with him for about 2 years, and that's when I really clicked for me. Like, I really need to be in clinical psychology, helping these children in foster care.
So that's your focus now, is clinical psychology with particular focus with kids in the foster care system.
Yes, I work very close with families and young kids, 0 to 5. So it is very dedicated to how the parents are also doing with the children.
What's something that, from your assessment, that the general public either misunderstands about the foster care system or don't understand about the foster care system?
So the foster care system is very difficult. It's very complex, and there is a lot of human error in it. It started within racist roots too, because it started as a way to separate immigrant families and Black families out and separate the children from them. And it became an institution of, just because you don't have money, especially after slavery, you don't have money, now that you're free, you can take care of your kids.
So we'll take
your kids for your benefit, quote unquote. And so I think that those roots have been maintained in the system. And there is a lot of people who work to really do well, but the system is really not working for families.
Even now.
And I think that one of the misunderstandings, is that a lot of the parents don't want to abuse their kids. And we think of the children who are in foster care as they have been abused and neglected by bad parents. The problem is that a lot of those parents were mistreated themselves, and they carry so much stigma, trauma, and institutional trauma that prevents them from fully doing what they need to do with their kids. So I see, especially with the young kids, I see a lot of the parents, they don't want to hurt their kids, but they are in active addiction. They don't know how to punish a kid, a 2-year-old,
without it being
physical or shaking them. So I see a lot of that, and we tend to shame parents for not knowing better.
I was just talking. Who was I talking to? I was talking to a friend of mine with regards to parenting is such a unique experience. I'm a father of 2 myself, and you don't, at any given time, I think I'm doing what I feel is best. Like I'm doing what I feel is best for my kids. And the world might be in a different space when my kids are old enough that they might look back and say, man, dad was, that was horrible what he like, you know, and so like the standards change with each passing generation. I often, when I reflect on that, it does afford me a lot of grace for how I look at parenthood and think about my parents or the generation that my parents come from, that no one is trying to be harmful. It's just that this is how they know how to do it best.
Yeah.
And so that's an interesting point that you're pointing out. Is like if they're coming from a systemic kind of conditioning where parenting is this kind of standard, how are they able to overcome that and to or even have the assistance like to overcome that and parent in a way that's much more beneficial for their child and themselves, really?
Yeah, and many times it is that you model based on what you saw.
Right.
And you try to do what it felt good, what felt safe for you. And many times you succeed, but many times you don't.
Right.
And if you consistently saw of parents who were neglectful or weren't there for you, you many times will try to not do that. But you don't know how to do it right, though. So that's what I see a lot with the parents. And I think that interesting that you bring that piece of how things change in society and the times. For example, funny story, I was with my parents and my sister a few weeks ago, and my sister has a 1-year-old, and she has been very intentional about how to parent her kid, and has been very intentional about her relationship with her husband. Of like, they talked about it before they got married. They said what they wanted to
about how they wanted to
children
raise
and how to raise their kids. And so we were talking a few weeks ago with my parents and her, and she asked them, do you guys ever talked about what you wanted or how you wanted to raise your kids? And they were like, no, nobody in my generation talked about that. And it was something like they were like stunned. Like, that's really good that you talked about that, but never occurred to me.
That's interesting. What are some mental challenges that you have? And I guess as a psychologist, I can ask it this way. What are some psychological challenges that you've, or at least the most common ones that you've seen in children going through the foster care system?
I see a lot of the trauma being seen in how they attach to people and how, especially with the younger ones, and their behavior. They express themselves through behaviors. And that's the best way that they know how to ask for their needs and talk about what they want. So I see a lot of aggression and tantrums of not knowing how to regulate their emotions.
How do you get through to them? And I'm sure it requires a lot of patience, time, understanding, empathy, all of those things that allow you to, that in general, that would allow you to be able to communicate in an open, honest, but at the same time in a way that doesn't push them away. How are you able to navigate? And I'm sure each child is different, but how are you able to navigate it in general?
I think that the main thing is through play. I think play is the most fantastic and amazing thing that happens to all people. Because through play, the child is reliving their fantasies, their fears, and their mastery of how to work on the world. When you see a 4-year-old playing a kitchen or playing family, they're not just having fun. They're also experimenting on how to connect with other people. And I think that that's the language that they have through play. And to us adults, sometimes we forget how fun and how important play is, because that's how they learn. That's how they try out things.
Are the kids in the foster care system, are they still, in terms of the majority of them, are they still in contact with the families?
So many of them do. It is mandated that they have to have at least 1 or 2 hours per week of visits. But it depends if the parents are, one, safe, and two, if they are responsive with their caseworker and the system. Because if they are not communicating with them, they are not going to set up any visits. But because many parents that I see do want to reunify with their kids, they want to get better, they are consistently trying to get more hours. But because they have addiction or trauma themselves or severe mental illness, they're not always in the right mind to be in contact with their kids.
If there's one thing that you could, one barrier that you can remove from the system, the foster care system, to say tomorrow, that you think could improve it dramatically, what would that be?
I think bias. I think that the system is very biased towards whoever wants to do things right, and there is a low compassion towards these families who have experienced a lot of negative things and negative stressors in their lives.
How would you change it?
That's a great question. I'm trying to figure it out.
That's another PhD.
Yeah, so interestingly, I work so close with DCFS, I go to testify for court once a month for different cases and different families as an expert witness, saying what it is maybe the best interest of the child and how to best help the families. So I try to, in that regard, I try to instill hope for the parents and instill compassion from the system. Because I think that understanding how the intergenerational trauma affects each family is going to help change things.
So you're really caring for not just the child. You're caring for the family unit as a whole.
Correct. Yeah, I do. For example, I do psychological evaluations for the parent. For if both parents are engaging, I do an evaluation for both of them, and then individual treatment with them and family therapy. So I'm doing sometimes 4 hours per week with one family.
Where have you found because through your journey thus far, so Chile to Texas, from Texas to Indiana to New Orleans. One, how did you choose Texas? Two, how did you choose Indiana? And then three, how did you get back? How do you come to New Orleans?
Yeah. Texas, it was an easy. I didn't choose it. It was chosen because my dad's sister has lived in Texas for 30 years.
And that's who you were saying, the connection with the psychiatrist.
With the psychiatrist, yes. So she received us when we came to the U.S.
Gotcha.
And I was there. And then I chose Indiana because of I was looking at the program and the specializations and the mentor that I had over there. It was
Mike. Oh, God. You
okay. So the specialization over there, it was in child. And when I went to visit, I just fell in love with the city. Felt like really small enough to focus on school, but big enough to have sports and
to be entertained.
And go out. And then when I came to New Orleans because I did my internship at LSU, and they had an internship that it was focused on infant mental health in foster care. So it felt like that was the perfect space for me.
What kind of health was that?
Infant mental health.
Infant mental
health.
What does that entail?
So it is the focus of how infancy and the toddler years, so 0 to 3, it really impacts your personality and your relationships. So it's so important to focus attention in the mental health side at that time, that we need to treat not the child, but the system, the family system, the environmental system, and societal system to help children and to help the future too.
How early are kids being entered into the foster care system?
As soon as they are born, sometimes. Because if they are born exposed to substances, illicit substances like fentanyl, cocaine, meth,
Up front.
in utero, they DCFS investigates as soon as that happens. And if there is no family member who can take care of the kid, they remove the child from the parents.
Wow.
Mm-hmm.
Wow. Is that happening often?
It is the number one reason for children to enter foster care.
The drug addiction from the parent.
So no, that age range, the 0 to 2, it is the highest number of children who enter foster care in the U.S.
So they are the highest percentage of children are babies, are children.
Yes,
not even children, are infants.
Babies. Yeah.
That is wild.
Yes, we think often of foster kids as being more teenagers.
Yeah.
And that is still a big proportion, but I would say I can't think of the numbers right now, but it is the big proportion is 0 to 5, 0 to 3.
Wow,
that's the biggest one.
What does that look like for them? So let's say a kid is born, they get into foster care. Where do they go first? Like, who's taking care of them? Because somebody has to foster them, right? So, but how does that work?
So DCFS has contracted with foster families who take care of these children. And after they leave the NICU, because usually the kids are withdrawing from substances, and they go into a family, and they stay with that family until they can either safely reunify with their parents, or another relative can step up, or they get out of foster care by adoption.
Now, adoption is one that, because I always put both together: foster, adoption from foster. What percentage of kids, I don't know if you know off the top of your head, what percentage of kids in the foster care system end up being adopted?
Out of 0 to 18 is about 30, and in adoption, I think it's about 60%.
60?
60.
That's better than I thought.
In adoption.
Yeah.
Yes.
What happens to the rest? They just kind of go through it?
No, the rest go either back to their families or linger in the system.
Wow.
And teenagers are who have it the worst too, because nobody wants to adopt them. And oftentimes if they are 16, 15, they may stay in the system for 2 years and then be out of the system.
Are they, especially for those teenagers, are they still hopping around different foster families? Is there a time limit that a foster family can have someone for?
No, there's no timeline, but until they are 18, they are no longer in the system. And the teenager has to sign up and has to do a lot of paperwork to sign up for this thing called extended foster care, where they can stay in foster care until 21.
Why is it not just 21?
Yeah, it beats me. Yeah.
That's crazy.
Yeah, because many of these kids need the support even longer than 21.
Yeah. What about schooling and, because 18 is right at the end of high school for most, your average 18-year-old, beginning of college. Who is taking care of schooling, and how is that like allotted? How is that managed? The
state is focused on the school and pays the foster parents to support going to school and all of that until they are 18.
I think there's some stigma about abuse in the foster system within the people that are contracted out, so the foster parents. Is that something that you have also experienced or seen?
I have seen a relative, for example, who became a foster parent for this kid, and she became very overwhelmed after 2 years of having this kid and this kid having behavior problems, and she started punishing too much this kid severely, that we needed to remove this kid from that house and go into a different house.
Is there a psychological evaluation too, like on a child by child basis of the foster parents?
We don't do like what we do because we focus so much on the first 5 years and their relationships. We do look at how the child is behaving and reacting to each caregiver, and we do see that how do they feel safe, do they feel engaged, do they feel afraid, and we try to see the attachment with each caregiver.
How are you able to, because it sounds like there's a lot of emotional burden. Who's your psychologist?
Yes, football. Football is real.
Football is life. Oh wow! I mean, because I'm as a doctor, I can empathize and I can understand how you can have emotional burnout, having to experience the degree of suffering and the degree of I'm sure it could feel like a betrayal for some of the kids, the degree of resentment, a lot of negative emotions that certainly the kids are carrying. And this is something that they're carrying on a day-to-day basis, as well as their parents. Because it sounds like to me, at least based on what you're telling me, that a lot of these parents want to do better and they can't. And I'm sure that also breeds some sort of I'm sure it leaves a mark psychologically.
Yeah.
So
yeah, and before answering your question that you are going to ask, how do I take care of myself?
Yeah,
I think that related to that mark that the parents have is, I don't know if you're familiar with the term moral injury.
Yeah. We talk about that in medicine a lot. Yeah.
So it is has become very popular in the army and stuff. And I had this idea about a few weeks ago that I see that the moral injury from the parents, because a moral injury is this sense of betrayal against your own values, against your core values. For example, if someone tells you to hit someone when you
don't want
violence.
To. Right.
And these parents, I believe that they experience some sort of that similar sense because they don't want to hurt their children, and yet they are doing that. They are putting them at risk. And they don't want to, they don't know how to
navigate that. Yeah.
I think that is something that I'm very interested in the past few weeks, that I started thinking about how to make it a project with this population to help them.
Yeah, we talk about that in medicine because the way the healthcare industry is set, and that kind of leads a lot to burnout as well. We talk about physician burnout as well and provider burnout in general. But moral injury in the sense that you are doing things like you highlighted, or you're forced to do things that you feel you're not doing right by your patients. And that can make its way in different shapes and sizes, different scenarios. I can think of one, for instance, is we are emboldened or trained to be an advocate for our patients. However, what happens when the patient can't speak for themselves and you are now relying on, say, family members to act as that surrogate, but they're making decisions that might be counter to what the patient may have truly wanted, if you knew that.
Right.
I think a lot of our moral injury comes from it's probably from a medical legal perspective, because you're trying to protect yourself from a legal
and the
sense.
ethics.
Yeah. And then two, it comes from also just being tired, like if you're overworked or and having that combination, I'm sure challenges your sense of like, am I doing the right thing? And I thinking about that, if you flip that for the parents, like, am I doing the right thing?
Right. Yeah. And sometimes they don't have even that conscious awareness that they're asking themselves. They're just acting, and then they react or respond to that. Oh, I shouldn't have done that. And I feel so bad, and I don't know how to make it better. And that is insidious type of injury.
Right.
Goes into the mind.
Right. Because you don't know when it started. You just know that it's there. So how do you, who is your psychologist? How do you cope with moral injury? How do you cope with situations that can feel hopeless, that can feel like there's nothing you can do, or challenging patients that, and I don't even want to say it that way, but that require something that you might feel like you are not capable of giving. How do you cope with that?
I think that's something that I'm still trying to figure it out. I go through episodes of using that hopelessness into action. Of I need to fight harder. I need to do more projects. I need to do more for these families. And other times when I feel depleted and I just don't want to do anything, and I just some survival mode. And during those times, I think that relying on my family and on my partner, my dog, I think that's the best, because my dog is a husky, so she needs to go out. That sounds like a challenging. AI.
The AI. What was that? That was ChatGPT?
Yeah.
That's hilarious. We're definitely leaving that in there.
So my dog helps me a lot, because she needs a lot of going out and walk. And sometimes I can use that as a mindful walk and being more present with my dog and the environment.
What does the future look like for you? You mentioned projects and stuff like that. What are you looking forward to in the short term? So in the next, say, 12 months, and then long term, from a professional perspective, if things go right as you would want it to, what does the next 5, 10, 15 years look like?
Yeah, so I am trying really hard. I work at LSU, so I work within the medical school, and I work with a lot of medical students who are in the medical Spanish. I work with a lot of communities with Spanish as well. And I've been focusing a lot on how to use the resources that the school and grants can provide for that population. I have a couple of grants that the deadline is like next week, where I'm trying to get more funding for providing more services to them. And I work in Washington Parish, which is kind of rural, in Bogalusa.
Oh, there's a Washington Parish in Louisiana?
Yes, it is farther than St. Tammany.
Oh, wow.
It is like 2 hours. And they don't have any resources over there. So I'm trying to also extend all the work that I do over there to provide more to the families. And I have a couple of grants like already written, and I'm like, I need to submit them soon to provide more for these families, because I think that's kind of my goal of how to support the system.
Is that the Latin Health Scholars program?
Yes.
Tell me a little bit more about that.
Yeah, so a few years ago, maybe 6 years ago, the medical students who spoke Spanish kind of developed this idea of getting together and practicing their Spanish. And then there was not a lot of formalization from the school. And then they asked me to kind of step up as the program director. And I started helping the students kind of formalize a curriculum during the 4-year medical school.
So it's incorporated into their education.
Yes, it is an honors program, and we accept whoever has over B2 of Spanish and can pass a dialogue in Spanish. And the idea is to provide more practice, resources, and opportunities for them to practice that medical Spanish. Because you can speak Spanish, but the terminology, you're learning it in English. So sometimes you don't know how to translate those words to the patient, who, one, doesn't have a lot of health literacy.
Right.
And second, doesn't speak English.
Right.
So we need to help these fill the gap and avoid the translators by just providing the service in their native language.
Do you feel like being bilingual has changed the kind of psychologist you are? Like, do you feel like being able to speak a different language, for instance, do you find that your approach to the human mind is a little bit different had you not been bilingual?
I think that the bilingualism, I don't know. I don't think so.
Okay.
I think the biculturalism, I think so. I think that I felt bicultural in Chile.
Peru and Chile.
Yes, Peru and Chile. So I felt, even when I was growing up, my friends in Chile would call me Peruvian as a nickname. Because I had a little bit of that accent.
Yeah.
It was my parents.
Right.
So I had that identity, and I felt like, okay, I am Chilean, but also I'm Peruvian.
Yeah.
And I think that here in the US, in psychology, it kind of has helped me understand more of how the larger society, the community, modifies who you are, your identity.
I can relate to that because born in Nigeria, grew up in Nigeria, moved to Jamaica. I think outwardly, like my default setting is Jamaican. Like at this point, my default setting is Jamaican, and certain conditions can prompt me to become very Nigerian, almost like 100% Nigerian. And if I was to reflect on myself, it's one of my favorite things about me is that there's a side of me that like I can tap into that I truly enjoy. Like I enjoy being, I describe myself to myself when I describe myself to myself as 100% Jamaican and 100% Nigerian. It's a weird thing that I truly, truly enjoy.
Yeah.
So I can appreciate that. I can appreciate how, especially growing up probably in a Peruvian culture in Chile.
Yeah.
But everything around you is Chilean. So like you have a good grasp of both. And there's something to be said about I don't know, neuroplasticity. I've heard this a lot about how people that speak multiple languages, and I love how you pointed out biculturalism. Or so if it wouldn't be polyglot, it would be polyculturalism.
Right.
Having that exposure, I'm sure that does something. Do you feel like that kind of hardens your mind in a way that makes you, because you're probably much more open,
right? Yeah.
To different experiences. You're probably much more open to how different people are in general, because you're by default different. Like in Peru, you're Chilean. In Chile, you're Peruvian. Do you think that kind of helps to form the mind in such a way that it might be protective?
I think so. I think that there is a lot of the neuroplasticity, especially in the formative years, of how your identity can be more adaptable and can feel more encompassing of I belong to both sides. And there can be some struggle, but at the end, it is this sense of I belong in these two spaces and I can adapt depending on the needs. And it can lead to a lot of resiliency. for the stress and for discrimination
Right.
against all these factors.
What role do you feel culture plays in healing, especially for kids in foster care? How? Because I don't know. I wouldn't know how. What even is the culture of foster care? I imagine it's probably not the most organized, and probably there probably isn't any sense of belonging in many ways, because that's what culture is. A culture is something that you belong to, that forms who you are in a very, very deep and meaningful way.
Yeah.
Music, the food you eat,
Rituals,
the things that you celebrate. I imagine the kids are robbed of that.
Yes.
How are you able to? How is the system, if it is at all, able to reconcile that for the kids, instill at least a sense of belonging to something beyond just the foster care itself?
I think that the foster care system is trying sometimes of if the parent cannot reunify with this kid and provide that culture, they're trying to find relatives. They are trying to find the grandma, the aunt, the whoever, the cousin who lives in another state maybe. But to bring that, to be able to have their child be raised in their own culture, because that is helps with the resiliency and the sense of belonging, as you said. It is crucial for identity later on.
What's been the hardest lesson that you've had to teach or learn from your work?
I think that self-care means saying no sometimes. And even if you're very excited about a project or about a meeting, about something, self-care is part of saying no. And that's what I struggle with.
Saying no.
Yeah, saying no.
I have a little list of things that I'm going to teach my kids. One of them is no is a complete sentence. So no, period. It doesn't require justification. It doesn't require explanation. You can say no, and that's enough.
That's your boundary.
Yeah,
and it is important to hold that boundary for your own sake.
I struggle with it too. I can't lie. I can tend to get into a lot of things. One of my things is, if it means that much more to somebody else and it doesn't mean that much to me, then I'll do it. Does that make sense?
Yeah.
But that can become overwhelming cumulatively. Like, as you know, as a bunch of things add up, that can be definitely overwhelming. The comfort of saying no, and then the pause after that, like, and being okay with that silence, being okay with that awkward
comfort.
Yeah, it's very awkward. Being okay with awkward. I think I would add that as well. It's okay to say no, and it's okay for that to be awkward at first.
Yeah.
How did the foster care system teach you that? How was that? How did that become a lesson you learned from that from your experience?
Because I keep saying yes, basically. So I think that my partner, she's a mental health counselor, and she works with kids, and she has great boundaries with work. And she's
fantastic boundaries.
Yes. And she is teaching me to say no and to help me with that. This opportunity or this project is very exciting, and I am very dedicated. Another might come. And these opportunities keep coming because I keep seeing that. Because I keep saying yes, and then another good one comes.
Right. Well, you've already said yes.
Yes.
Who is someone in your professional life, and you don't have to say their name, but is there someone that you look up to that serves the role as mentor, or as someone you can bounce your experience or your feelings to on, someone that helps you kind of navigate some of these challenges that you're experiencing? It sounds like you're kind of on the forefront of a lot of this stuff. So do you have someone that you can, like have these very difficult conversations with about what you're experiencing and what you're seeing?
Yeah, so I have one mentor. She was my supervisor when I was an intern and when I was a postdoctoral fellow. And she's now my colleague. And we work on the same area, different parishes, but doing the same thing. So we collaborate a lot. She helps me a lot. It has been more, it has been less of a mentorship and more of a colleague type of relationship now.
Which is the nature of these things.
Yes. And I think that, but that allows me, she has like 20 years of practice or 30 years of practice. So she has a lot of experience with these things, and that is very helpful.
In your experience, what's something that the general public misunderstands about mental health that they should have a better grasp on?
I think that it all stems from society. I think that society plays a big role. And I think that definitely the brain plays a huge role in how the serotonin and all these chemicals influence the brain. But what we consider normal or functioning is dependent on the system that we are and the culture that we are.
That's true. And you don't choose a lot of that.
Right. You are just born in it.
Right.
And you don't ask to be born. You just come.
Right. You just come and get into it. Yeah. I'm a physician. Before getting into, I wanted to be a psychiatrist. I should add that. I wanted to be a psychiatrist when I went to going into medical school. I wanted to be a psychiatrist. I am also fascinated by the mind. I love thinking about the way people think. I'm probably more philosophical. I would like to think that more philosophical.
You're speaking my language
than I am anything else. Really, I like to. I ponder about a lot of things. My mind wanders. Psychiatrist and psychologist. Why aren't they just the same thing?
Politics, baby. I think that it became the medical model, and that's what we follow a lot of the times. And I think that back, when was it? Maybe in the 20s, when we started dividing that between psychologists and psychiatrists, that we started thinking of the how can we understand the person outside of just the medical model, of just the behavior or just the brain, but also the relationships that they have. And I think that's when it started changing. And I think that psychiatrists, even Freud was giving therapy. He was doing therapy, and he was one of the pioneers of talk therapy. And he was a psychiatrist. And he continued the psychoanalysis and that type of therapy. But that kind of stuck more with psychology rather than with psychiatry. Psychiatry, for the most part, does do some therapy, but they focus a lot on the medication piece.
Therapeutics.
Yes, right. Therapeutics of like an intervention of you're thinking about A, how can I make you think of B?
Gotcha.
I'll give you a medication to help with behavior A.
Gotcha.
But psychology deals more on the personal level, on the person's holistic approach.
Do you feel like a psychiatrist would agree with that assessment?
I think so. I work with the fellows, with psychiatry fellows, and I have several colleagues in psychiatry, because I am embedded in the psychiatry department.
Via the medical school, yeah.
So I have a lot of them, and they don't do therapy. And if they do, it is 1 hour per week or 2 hours per week.
It's very different.
Yes. It is appointments, 15, 20 minutes, 30 minutes versus...
It's a medical field.
Right. It is a medical field, and that's what pays too.
I have a bold take, a hot take. I think that neurology as a field, psychiatry and psychology as a field should all be just one field.
Yeah.
Because you're dealing with the same organ. Every other organ has a singular, and then you have subspecialties underneath it. But I think neurology, psychiatry, and psychology should all be under one field. Is there a profession that does encapsulate that? Is there a neuropsychologist, psychiatric psychologist? Like, I feel like that would, that's a brain physician, if you will, or brain specialist, or like, why isn't that all just one? But I guess what you're saying, it's politics.
It is politics. I think it is a lot of politics with APA psychology and APA psychiatry and how they divide themselves too. But an interesting point to that, I guess, conjugation of all of these fields is that in existential therapy, there is this
existential
as in philosophical existential, and more understanding how the person is in this existence, and we need to figure out what we are. Life is intrinsically meaningless, and we give meaning to life. I see you smiling now. You like that?
I like it because it reminds me of, and I didn't mean to interrupt you, but what's his name? Viktor Frankl?
Yes, exactly. That's existential therapy.
Yeah. Viktor, his book is here somewhere, but Man's Search for Meaning is one of my favorite. My mom told me about that book, and I think she bought me the book many, many years ago. It's one of my favorite books about logotherapy.
Yes.
But anyway, I'm sorry, go ahead.
Yeah. But I think that that's a key aspect of how now because of this medical model and how what pays the bills is a more medical model, there has been an emphasis on how to incorporate the neuropsychology part into the more understanding of the person.
Is that cognitive behavior therapy? It's
even more than that. It is more a more integrative way of thinking. I was reading one article about how to incorporate the endocrinology part, the neurological part, the psychological part, and the psychiatric part, the brain.
I mean, we are nothing if not a balance of hormones.
Right.
So endocrinology certainly plays a role.
Yeah, and we are the sum of our parts.
We are the sum of our parts. I always, not always, but I often think about how if one of the neurotransmitters, neurohormones in me was off by a little bit, I would be a very different person. And that delicate balance is really, but if you think about it that way, you really have to then appreciate a sound mind. Yeah.
And yet it is the most common thing.
It is.
Right?
It is. You're right.
Yeah.
It's crazy to me. It's crazy to me.
Yeah.
Even the ones that we think of as positively, another quote that I love is the dose makes the poison, right? And the same applies to our hormones, right? To the neurohormones, the neurotransmitters. The dose makes the person, if you will.
Yeah.
We are but the sum of a well orchestrated and well balanced neurotransmitters. Do you think that, because there's a lot of talk now, a lot of controversy about over-medication, definitely polypharmacy, especially now given that, we're talking about the psychiatric medical model about just, giving something, giving a pill or a injection or, to help address some sort of psychiatric disorder where perhaps a much more intuitive, cognitive, existential therapy might have been more beneficial, even though it might take more time. How do you feel about that?
Yeah, that's striking a chord with me. Because I think that in this society, capitalistic society, we need solutions now.
Right.
We need what works right now.
Right.
Because we need a what do you call it when you get a cut?
Band-Aid.
A Band-Aid. You don't need to figure out how to fix the whole why you got a cut, right? You just need a Band-Aid.
Band-Aid it and keep it moving.
Right. So I think that there is a lot of emphasis on how to get the solution right now and move on.
Yeah. I mean, and of course, time. Capitalism is a time-based, the more you're spending on something is probably more money you're losing.
Right.
Right. So the quicker you can solve it for roughly about the same amount of money, the better it is. And it's not even solving. It's just like make it less of an issue enough that you can keep on moving.
Because the idea is to get you functioning. And how do we define functioning is we can define it as you feeling bad, but we can also define it as are you productive with work, with your family, with your responsibilities with society.
What do you think the future of psychiatry and psychology looks like? What do you think the future of societal understanding of that field? What do you think it looks like?
I think internally in psychology, I think that there is going to be a rift into psychology as a medical field and psychology as a more existential, holistic, philosophical field. I see that with different theoretical understanding of how people work and how people do things. And I don't know if it is going to be soon, but I do see that rift in how people think about things.
So actually that's just going to widen the rift that's already there between psychiatry and psychology.
Right. And I think that at the end we will have 20 different fields that should be one.
Right.
But I think that we get so many new developments in how the brain works that are fascinating and are so eye-opening for all the fields related to the mind that we could find common ground and understand, okay, what can we do outside of politics?
Right.
And how
politics
can we
and bureaucracy.
Help it? Yes.
Fascinating. I always ask my patient. That's a patients. My guests.
Oh my God, Freudian sleep.
I hope you're never my patient. I always ask my guests if you could. This is a two-part question. Where do you see yourself in 5, 10, 15 years? And if you were to introduce yourself, how would you introduce yourself? So we could do the first one first.
If I can introduce myself in those years or now?
Even now, if you were to introduce yourself now to someone that has never met you, how would you do so?
I'll respond the first one because I think it's easier.
Okay.
I see myself in 5 years continue working at LSU, continue working this bill, all these projects that I have going on. In 10 years, I see myself going somewhere else. Going to my sister lives in Knoxville, Tennessee. And she's thinking of moving to North Carolina. So I want to be close to her and her kid.
Gotcha.
And my parents might follow along.
Naturally. So where are they now, by the way?
In Dallas.
Gotcha. That's right.
So I see myself continue to do the same type of work in just different settings. I think that my passion for helping marginalized families is what keeps me going every day. And I was saying 20 years, I would say retire, but I don't think that it's going to be possible.
Because of the current economic climate or because of who you are or both? Because you can't see yourself actually walking away from something like this.
I think that I can walk away from it.
You can.
I cannot. And the current political climate, my student loans.
Those are going to be with you
forever. Unless I go to Chile.
Mm.
Mm-hmm. I think that maybe I could retire in Chile. That could be
Would you be able to still do the work you do in Chile?
I think so, yes. Because there is psychology and I would be,
Wait. So how does moving to Chile eliminate your student loans?
Because
you can't say?
No, I don't know. It might get me in trouble, but the US wouldn't. Maybe they might be able to extradite me, but I don't think that.
Not for student loans. Not for student loans, yeah.
Yeah.
All right. And then how would you introduce yourself?
I would introduce myself today as just a guy trying to be more compassionate with the world, with people. I think that I thrive in connection, and I really enjoy spending time with people. And I see a lot of suffering with my work. So I try to help as much as I can while trying to be there for those who need it and for those who want it. Yeah.
Dr. Del-Corral, it's a tremendous pleasure. Do we have a game Wednesday?
No, I don't think so. We lost.
We lost. We didn't even make the playoffs.
Game.
No, that's not true. We lost every single game?
Yeah, we did. Yeah, this season.
Damn.
Yeah, last season we were in the semifinals.
I mean, ebb and flows. That's the way it is.
Mm-hmm.
That's the way it is. I appreciate you coming. Any questions for me? I always ask as well.
Mm-hmm. I'm very curious now. How would you introduce yourself? How would you introduce to your kids?
Oh, to my kids, it's that's interesting because I don't think I'm not the father I thought I would be.
Mm-hmm.
I'm a lot stricter than I thought I would be. I'm a lot sterner. In fact, so much so that, and I've said this several times, that my personality as a dad and my personality, like my real personality, are two different people. I don't know why that. I think I know why that is. I think we hinted at that earlier, like how you were raised informs how you raise. And my hope, I think, for my kids is that when they're older, that we can be friends, right? Like I hope to raise kids that I would love to be around. You know what I'm saying?
Yeah.
Like that we can hang out, and I don't want to be like, man, like if I was to meet my child as another person, I don't want to be like, man, that's a dick or that's an asshole or whatever. So if you were to ask me how I really want to introduce myself to my kids, is like that is actually really, really fun. Like I'm really fun. Like
believe me.
Yeah, believe me. I'm not a stickler for these things. Like I enjoy the lollipop. Trust me, I want it too. I want the cake.
Yeah.
I want the cupcakes.
And I think that they need to hear that too, though. I really do, because I think that they get frustrated. Young kids will get frustrated. And they're trying to understand their own feelings. And you as an adult understand their feelings. But you need to communicate that you understand the feelings to that level. They are able to then communicate to you.
It's funny because what I lack, you know about the Feynman technique of how to learn something new. Have you heard about this?
No.
So the Feynman technique, and this is what I used in the later years of medical school and in training in my residency, was imagine that you're talking to your 5 or 7 year old
self.
Not even self, but like your sister or your cousin or just a 5 or 7 year old.
Okay.
And you're trying to learn something. So try to explain to them that which you're trying to learn. And if you find yourself using words that they would otherwise not know, then you need to go back and then your understanding of that particular subject isn't deep enough that you can explain it to a 5 or 7 year old. Does that make sense?
Yeah.
So I say that to say, just today, I was having a conversation with my son, and I said something like, I think the word I used was like, why are you wallowing? I said wallowing to my 3-year-old.
Right.
Like, how is he supposed to know what that is?
Right.
So I think the same applies to, I don't think we understand the emotions as well as we do.
That's true.
As well as we think we do.
That's true, yeah.
I don't think I understand, I don't think I understand my emotions as well as I think I do, let alone the child's emotions. So, I think I said whining was what it was. I was like, stop. I was like, why are you whining? He has no idea what whining means per se.
The difference between whining and crying.
Yeah, whining, crying, all of that means exactly, like every time I use it, he's either crying, like he's doing a lot of different things. So he's like, I don't know why I'm whining. And the truth is, neither do I. I can sense that you're probably frustrated. But I can't use frustrated either. Like, you don't know what frustrated means. Like, and so I can't say, I know you're frustrated. Like, that's not a word to use to with my 3-year-old. Like, I know you're frustrated. He's like, frustrated. You just like, what does that mean?
Just a word.
That's just you're just mumbling stuff to him. So, I hope that as I understand myself better, because I'm part of it too, is that kids are great educators as well for your parents. So I hope as I grow as a man, as a father, that I'm able to understand my emotions in such a way that I can communicate much more efficiently with my kids. But I would introduce myself as I'm actually very chill. I'm a very relaxed person. I don't consider myself, I think many people may incorporate things like their profession into stuff like that, but I don't consider myself a doctor outside of the hospital. I don't introduce myself that way. Outside of the hospital, if somebody walked by me and said doctor, I wouldn't even respond, because I have no connection to it outside of the hospital. So I would introduce myself primarily as your dad. That's your mom's husband, and to my kids, obviously. And and I'm very, very I'm a lot chiller than you're going to experience right now. But I hope that you, at some point in the future, that you can see like chill Ugo, like who I think I really am. I think that's how I do it.
Yeah, interesting. I like that. Next time I'll bring my emotion wheel.
You have an emotion wheel?
Yeah, that's how I teach emotions to kids.
What?
Different emojis and emotion faces. The wheel, because we can go from sad to feeling depressed, to feeling grief, to feeling more deeper emotions that require more vocabulary of emotions.
Speaking of emotions, one of my favorite new quotes that I've heard recently is from Alex Hormozy. You know who that is?
Yeah.
He's some kind of he's an entrepreneur. He's been on a few podcasts, but anyway, the quote is basically, one of the best superpowers you can have as a human being is to be happy for no reason.
I like that.
Because you can be sad often for no reason. Like you can experience other emotions for no reason, but to be happy for no reason at all, like to just happy yourself for no reason, is a superpower, and it's one that has been lingering and floating around my mind a good bit. Thank you so much, man.
I appreciate it.
This was great.
Yeah.
You got to start your own podcast. I feel like you'd make an excellent podcast especially about the stuff that you talk about and the things that you're experiencing and going through. I think
That's another project that I need to say yes.
Would you say no for now?
I can say no.
Excellent.
Thank you, man.
Yeah, man.
Cheers.